I know why you clicked on this video. You want straight answers about your Social Security check, your Medicare costs, and what all the headlines really mean for you next year. You're tired of surprises. You're living on a fixed income, you're careful with every dollar, and you need to know if that raise you heard about is going to help, or if something else is going to eat it up before it ever reaches your bank account. You're not alone. Many older Americans have the same questions right now. And the truth is, a change in one program often triggers changes in another. That's what makes this so confusing and so frustrating. So today, I want to walk with you step by step, make everything easy to understand, and help you plan ahead so you're not blindsided when that first 2026 deposit arrives. Let's start with the headline everyone saw. Social Security announced a 2.8% cost of living adjustment for 2026. On the surface, that sounds like good news. It's a little higher than this year's increase. After 2 years of stubborn grocery bills, rent edging up, and medical costs creeping higher, even a small bump can feel like the system is finally noticing what you've been paying out each month. But I want you to hold that thought and look deeper with me, because that 2.8% is only one piece of the puzzle. Your Social Security check in January is shaped by several moving parts, and not all of them move in the same direction. Right behind the COLA news came another update. Medicare Part B premiums are going up sharply. The standard premium is scheduled to rise from about $185 to $202.90 per month. That's a 9.7% jump, which is more than triple the size of the COLA. And here's the part that catches many people by surprise. If you're already receiving Social Security, Medicare takes that premium out before your benefit ever reaches your account. You don't write a check each month. You don't pay it at your doctor's office. It's automatic, and it happens the moment Social Security calculates your payment. That means part of your raise will be used to cover this higher premium the very same month you get it. I want to make this real with a simple example. If your Social Security benefit is around $2,000 a month, a 2.8% COLA would add about $56. But the Medicare Part B increase takes back $17.90. So your actual monthly increase isn't $56, it's closer to $38.10. That's before we even talk about prescription coverage, fuel costs, or a dental bill that shows up at the worst possible time. If your benefit is closer to $1,200, a 2.8% COLA gives you around $33.60, and almost $18 of that goes to Medicare. That leaves roughly $15 and change. If your benefit is higher, say $3,000, a 2.8% COLA adds about $84, and after the Medicare increase, you're looking at about $66 more in your pocket. For a lot of you, that number tells the story better than any headline. It's not a cut, but it doesn't feel like a real raise either, not after paying for groceries, rent, utilities, and the copays that keep showing up. Why does it work out this way? Part of the answer is the formula used to calculate the COLA. The annual Social Security adjustment is tied to an inflation measure called the CPI-W, which is based on spending by workers. That's the law on the books. But retirees don't spend like workers. You tend to pay a larger share of your budget on healthcare, prescription drugs, insurance premiums, property taxes, utilities, and housing. When the government measures inflation with a worker-based yardstick, it can miss how fast your essentials are rising. Even when overall inflation cools down, the specific costs you face often keep creeping up. That's why so many of you say, everything's going up except my check. It's not a complaint, it's a description of what you're seeing in your life. Now, I want to explain another rule that will matter for you in January. It's called the hold harmless rule. It's there to protect most people on Social Security from having their checks go down just because the Medicare Part B premium goes up. If you're already receiving Social Security and Medicare deducts the Part B premium from your benefit, the law says your benefit won't decrease from one year to the next due solely to a Part B increase. That's good news. But hold harmless doesn't mean your raise will be safe. It means Medicare can take up to the amount of your COLA. So your check should not go down, but a lot of your raise can disappear. That's exactly what we're looking at with a 2.8% COLA and a 9.7% premium increase. Your deposit will likely be a little bigger, but not by as much as the headline suggests. And if you're expecting $56 and you see $38, that gap can be frustrating, especially when your budget is finely balanced. There are also people who aren't protected by hold harmless. If you're subject to IRMAA, the income-related surcharge for higher income beneficiaries, your premiums can jump more than the standard amount, and hold harmless will not shield you the same way. If you enrolled in Part B recently and you're not yet having the premium deducted from Social Security, or if you pay Part B directly from a bank account or by invoice, the hold harmless rule may not apply to you. And if you're not receiving Social Security yet, you're outside of that protection. For those groups, the increase in Part B can feel even heavier because it isn't limited by the size of your COLA.
Let's talk for a moment about IRMAA, because it causes a lot of confusion. IRMAA looks at your income from 2 years earlier, using your tax return, to decide if you owe a surcharge on top of the standard Part B premium. If your income in that earlier year was above certain thresholds, your Medicare premiums go up. But here's something many people don't realize. You can ask Medicare to reduce or eliminate IRMAA if your income has come down because of a qualifying life-changing event. Retiring after full-time work, losing a spouse, a reduction in pension, or a major loss of income can all be reasons to appeal. The form used is called SSA-44. If you had a higher income 2 years ago, but now you're living on a fixed retirement income, it's worth looking into this. You have the right to appeal and present your new, lower income. And if you win that appeal, you could save hundreds of dollars a year on premiums. Now, let's go back to the day-to-day reality. You may be thinking, $38 isn't nothing, but it doesn't stretch far. A few bags of groceries, a jump in the electric bill after a hot month, a refill on a prescription you can't skip, these can wipe out a monthly increase in a single errand. When we talk to people who rely on Social Security, we hear the same stories. You find yourselves dipping into savings earlier in the month. You cut back on fresh fruit, delay a doctor's appointment, or stretch medication a few extra days. You make decisions you never had to make when you were working. Nobody should have to choose between a blood pressure refill and the food that keeps you healthy. That's why planning ahead matters. It doesn't fix everything, but it can soften the hit and reduce the stress.
One practical step is to look at your January budget now. If you have auto payments set to go out right after your deposit, think about the exact date your Social Security arrives. For most people, payments are scheduled based on your birthday, often on the 2nd, 3rd, or 4th Wednesday of the month. If your bills are due earlier than your deposit, call your utility or service providers and ask to adjust due dates so they line up with your new schedule. It's a simple phone call that can prevent overdrafts or late fees. Also, check your direct deposit information at your online Social Security account or on paper if that's how you prefer to handle it. Make sure your bank account details are current. A small error can delay a deposit, and that delay can cascade through your monthly plans. Another place to look is your Medicare coverage during open enrollment, which comes every fall. If you're on original Medicare with a Part D drug plan, review your plan's formulary to make sure your medications are still covered at a reasonable cost next year. Plans change formularies, preferred pharmacies, and copay tiers. A drug that cost $15 last year can jump to $40 next year without warning if you don't check. If you're in a Medicare Advantage plan, make sure your doctors and hospitals remain in network and look carefully at the out-of-pocket costs, especially if you use specialists or have ongoing treatment. Sometimes a change to a plan with a lower drug copay or better out-of-pocket maximum can save more over the year than the extra amount you'll pay in premiums. It takes some time to compare, but it's worth it. Every dollar you can keep is a dollar that stays in your grocery budget.
If the Part B premium increase feels like the last straw, consider whether you qualify for programs that help with Medicare costs. Many people who qualify never apply because they assume their income is too high or they don't want to deal with paperwork. The Medicare savings programs can pay some or all of your Part B premium if your income and assets are within certain limits. If you qualify for QMB, SLMB, or QI, your state may cover the entire $202.90, or part of it, so your Social Security deposit would no longer have that premium deducted. That's a big relief for many households. The Extra Help program can lower your Part D prescription costs, reduce premiums, and bring down your copays at the pharmacy. If you were told years ago that you don't qualify, check again. The rules change, and in recent years, some limits have expanded. Your local state health insurance assistance program, often called SHIP, can help you apply for free. You don't have to do it alone. While we're talking about assistance, it's also wise to look beyond Medicare. Property tax relief programs, energy assistance for heating and cooling bills, and SNAP for groceries can all bring some breathing room to a tight budget. I know some people feel hesitant about applying for help, but these programs exist because lawmakers know retirement incomes often don't match real costs. If you qualify, you're not taking anything away from someone else. You're using tools that were designed for this exact purpose. Reach out to your local area agency on aging or a community nonprofit and ask what's available. They can help you fill out forms and gather the documents you need.
Let's come back to Social Security and talk about taxes, because they can slip in quietly. A COLA increase can raise your total income a bit, and that can affect how much of your Social Security is taxable. The way your benefits are taxed depends on your other income, like pensions, wages, withdrawals from retirement accounts, and even interest. Once your combined income passes certain thresholds, up to 50% and then up to 85% of your Social Security benefits can become taxable. That doesn't mean 85% tax. It means that portion of your benefits is included in your taxable income. The thresholds for these calculations haven't moved for decades, so it's possible that a small increase in your benefits could push you into paying a little more in taxes next year. If you had a big surprise this year when filing your return, you can ask Social Security to withhold a small amount for taxes from each check going forward, or adjust withholding on other income sources to keep things predictable. The form is simple, and you can change it later if your situation changes. If you have a 401k, IRA, or other retirement account, you may be taking monthly withdrawals to supplement your Social Security. Some people consider taking a few extra dollars per month next year to make up for the smaller net COLA after the Medicare increase. That can work, but be careful. Withdrawals can affect your taxes, and higher income can feed into Medicare's IRAA calculation down the road. If you're close to an income threshold, a small change could have bigger consequences 2 years later. A planning conversation now, even a simple review of last year's tax return and this year's expected income, can prevent expensive surprises. If you prefer not to use online tools, call your local tax counseling service for seniors or a trusted tax preparer who understands retirement issues. A short appointment can save you money and stress.
Let's address something sensitive: the fear of losing benefits because of these changes. A COLA increase might bump your countable income for programs like Medicaid or SNAP. States have rules about reporting changes in income. Usually, you must report changes within a certain number of days. If a small raise puts you slightly over a limit, don't panic. Some programs have protections, spend-down options, or special categories for people with medical needs. If you receive a notice saying you no longer qualify, you can request a fair hearing. You have the right to ask them to explain their calculation and to check if all your allowable deductions were counted. Many people win when they appeal, especially if a mistake was made. Keep your letters, keep notes of who you speak to and when, and don't be afraid to ask for help from a legal aid office or a local advocacy group if you need backup. Knowing your rights is part of protecting your monthly budget. Now, timing. The COLA is typically announced in the fall, after the government measures inflation in the late summer months. Medicare premium changes are also finalized in the fall. Your first check with the new amounts will arrive in January, unless you receive supplemental security income, which often pays on a different schedule. This is why so many people get caught off guard in the new year. The holidays are busy, the mailbox is full of mailers and ads, and small print gets overlooked. I encourage you to set a reminder to open and read any envelope from Social Security or Medicare this fall. If you use online access, sign into your account and look at your benefit letter. It's okay to call and ask questions if something doesn't look right. It's better to ask in October than to find out the hard way in January when your deposit doesn't match what you expected. Let's also talk about mistakes and fraud, because both happen. A mistake can be as simple as a miskeyed number that changes a deduction. Fraud can be a text message pretending to be Social Security, telling you to click a link to fix a problem or else your benefits will stop. The government does not threaten you by email or text, and they do not ask for fees or gift cards. If you receive a call or message that feels urgent or scary, hang up and call the official Social Security number or Medicare number yourself. Use the number on your card or on the official website. And if you need help, ask a trusted family member to sit with you while you call. You're not being a bother. You're protecting your benefits. Many of you have told me you feel like you did everything you were supposed to do.
You worked, you paid into the system, you waited until retirement, and you counted on these annual increases to help you keep up. When the math doesn't line up with the headlines, it creates a feeling that the system isn't hearing you. I see that. The design of the COLA doesn't perfectly reflect retiree spending. Medical costs move differently than the broader economy. The Part B premium can jump for reasons that have nothing to do with your personal health. All of that makes the planning burden fall on you. But there are tools and rights built into the system, and when you use them deliberately, they can help you stay afloat even when the numbers aren't ideal.
So, what should you do next? First, write down your current Social Security benefit amount before the raise. Then write down the estimated 2.8% increase and subtract $17.90 for the standard Part B increase. That gives you a realistic picture of what your January check will look like. If you have IRMAA, check last year's letter to see your current bracket and think about whether your income has dropped. If it has, plan to file an appeal using the SSA-44 form. If you pay Part B directly, set aside the extra $17.90 now so it doesn't surprise you in January. If money is tight, call your state health insurance assistance program to ask whether you might qualify for a Medicare savings program that could pay your premium. And mark the Medicare open enrollment dates on your calendar so you can review your plan carefully. One phone call and one plan comparison in the fall can make a real difference over the entire year. Second, look at your other bills and subscriptions. Do you have services you no longer use? Are you paying for multiple streaming services when you only watch one? Can you negotiate your internet or phone bill? Companies often have loyalty discounts if you ask. Small savings across a few bills can add up to more than your net COLA increase, and that gives you breathing room. If you feel overwhelmed with calls, ask a trusted child, grandchild, neighbor, or community volunteer to sit with you while you make them. 2 sets of ears are better than one.
Third, prepare for taxes now. If you owed last year and didn't expect to, consider having a small amount withheld from your Social Security check for taxes. It's optional, and you can adjust it later. If you're taking withdrawals from a retirement account, talk to the financial institution about setting up withholding that matches what you actually owe so you're not facing an unpleasant surprise in April. A little planning spreads the cost over the year and keeps your monthly budget steady. Fourth, keep your paperwork organized. Put all your Social Security letters, Medicare letters, and insurance plan documents in one folder. Keep copies of any forms you send and notes of any calls you make, including dates and the names of people you speak with. If something looks wrong in January, you'll be ready to ask for a fix, and you'll have everything in one place. That confidence alone reduces anxiety. Finally, remind yourself that you're not powerless. You can appeal IRMAA if your income drops. You can ask for help paying your Part B premium through state programs. You can change your Part D plan if your prescriptions become expensive. You can check property tax relief, utility bill support, and food assistance, even if you've never used them before. These steps are not about giving up. They're about using every lawful tool to protect the retirement you earned. I want to end with a clear takeaway. The 2026 Social Security COLA of 2.8% sounds helpful, but a 9.7% increase in the standard Medicare Part B premium from around $185 to $202.90 will consume a large slice of that raise for most people. Your check should not go down if you're protected by the hold harmless rule, but the net increase you see in your bank account will likely be smaller than you expect from the headline number. That disconnect is what causes confusion and stress in January. The way to avoid that stress is to plan with the real numbers. Review your Medicare coverage during open enrollment, look into programs that can help with premiums and drugs, and consider small adjustments to your bills and your tax withholding. If you do those things now, you'll walk into the new year informed and ready, not surprised and scrambling.
You've paid into the system your entire working life. You have the right to clear explanations, to fair treatment, and to programs that help you when costs rise faster than your checks. My goal is to help you understand the rules, protect your rights, and make sure you're not caught off guard by the changes you can't control. If this helped you feel a little more informed and a little less anxious, share it with a friend who might be worrying quietly. Sit down together and go through your letters. Make a plan for open enrollment. Encourage each other to apply for help if you qualify. And remember, asking questions is not a sign of weakness. It's how you make the system work for you. Before we go, a quick reminder. Always verify numbers and dates from official sources because agencies sometimes update guidance or make adjustments. The figures we discussed today reflect the current updates and typical rules, but laws and policies can change. Nothing here is personal, financial, tax, or legal advice. It's general information meant to help you ask the right questions and take the next helpful step. If your situation is complicated or you're unsure, talk with a qualified professional or a trusted counselor in your area. Take a breath, make your list, and give yourself credit for staying on top of this. With a little preparation now, you can start 2026 with fewer surprises and more control.